Good morning to all. Myself, Dr. Ravi Mundugaru, Assistant Professor in the Department of Pharmacology at Adichunchanagiri Institute of Medical Sciences, Beach Nagar, Mandya. So today I am going to speak on anticholinesterases. Also we can call it as indirectly acting cholinergic drugs. Indirectly acting cholinomimetic drugs. So today we are going to deal about what are the different pharmacological actions, therapeutic uses, and adverse effects of anticholinesterases. So before starting, I would like to give a small introduction about how this cholinergic system will work in our body. So here if you see, this is a prejunctional neuron, this is a postjunctional neuron. Acetylcholine will be synthesized and stored in the prejunctional neuron. When a signal comes, this stored acetylcholine will be released into the synaptic cleft and it will quickly act on the receptors present in postjunctional neurons. It might be muscarinic receptors or nicotinic receptors. So after eliciting function, this will be quickly terminated. This acetylcholine action will be quickly terminated by an enzyme called as true cholinesterases or acetylcholinesterases. So these are the enzymes which are eagerly waiting for this acetylcholine, and it will metabolize into choline and acetate. So this choline will be again reutilized for the synthesis of acetylcholine. So thus this cycle will continue. So how does this acetylcholine action will be terminated? Means it's a responsible candidate is an enzyme called as acetylcholinesterases. So our target is this enzyme acetylcholinesterases. If you inhibit with a drug, so how does this acetylcholine will act? How does this accentuates or potentiates acetylcholine action? This is how we are going to deal about this anticholinesterase action. So this is a main mechanism behind indirectly acting cholinomimetic drugs or anticholinesterases. So before that we should categorize how does this anticholinesterases can be categorized. First one is we can categorize as reversible inhibitors and irreversible inhibitors. The name itself indicates reversible means we can reverse this action of acetylcholinesterase enzyme. In case of these drugs, we cannot reverse. It's an irreversible process. Irreversible process in a one direction. Here, if you increase acetylcholine concentration, we can reverse back that action. So thus we can call it as reversible anticholinesterase inhibitors and irreversible anticholinesterases. So today's class we are going to deal about what are the drugs comes under reversible anticholinesterases. So drugs such as physostigmine, neostigmine, pyridostigmine, edrophonium, rivastigmine, donepezil. So all these drugs comes under reversible anticholinesterases. So we will take one by one and we will see what are the pharmacological actions, therapeutic uses, and the common adverse effects of individual drugs. When you focus on physostigmine, so here it is mainly derived from plant product called as physostigmine vinanosum. So this is a plant which produces physostigmine as a alkaloid which has tertiary amine structure. So this structure will help in the good penetrating power through cornea as well as blood-brain barrier. So it has a very good action. Particularly, it will elicit muscarinic effects. So muscarinic receptors, wherever these muscarinic receptors are distributed, that will this drug will going to act on that muscarinic receptors and elicit the function. So mainly it is used in importantly two conditions. One is glaucoma as an adjuvant therapy along with the pilocarpine, and in belladonna poisoning or atropine poisoning as an antidote. So this is a particular to therapeutic utility of physostigmine. Another category drug is neostigmine, comes under the same category, neostigmine, but much potent than physostigmine. But it has its own drawbacks, such as it is a synthetic component. Chemically, we are synthesized this neostigmine. It's not a natural product, but it has a quaternary ammonium compound. Like the structure is quaternary ammonium compound. So the structure is very poor in penetration through blood-brain barrier. It cannot cross cornea. We cannot cross. So glaucoma we cannot give neostigmine, but we can give physostigmine. because it will, when you instill on the cornea, it will get absorbed into the cornea and will cause therapeutic action in glaucoma condition. Thus, neostigmine cannot, because it cannot cross cornea. But it has other therapeutic utility such as post-operative urinary retention, paralytic ileus, myasthenia gravis, and curare poisoning. So these conditions we can use neostigmine. So to understand this in a deeper depth, you should know what are the pharmacological actions of acetylcholine or cholinomimetic drugs. So here ultimately acetylcholine concentration will increase in case of anticholinesterases. So it will cause constriction of pupil in eye, in lungs it will cause bronchoconstriction and increases bronchial secretion. So it can predispose or it can worsen the condition of asthma. Another important action is it will decrease the heart rate. We know heart is supplied by vagus nerve. So vagus nerve, when it's stimulated, it will release acetylcholine. It will decrease the heart rate. So thus we can say all cholinomimetic drugs, indirectly acting cholinomimetic drugs, will cause decrease in heart rate, cardiodepressant property. In blood vessels, it will cause dilatory effect and causes hypertension. And in gastrointestinal tract, it will increase peristaltic movement and gastrointestinal secretions. So there is a high chance of gastric acidity, like gastric ulcers, or increased gastric secretion, increased peristaltic movement can cause diarrhea-like symptoms and abdominal cramps. And important action on urinary bladder is constriction of bladder, urinary bladder detrusor muscle, and relaxation of trigone sphincter. So it will help in micturition or urination. And all exocrine glands, including salivary gland, lacrimation, sweating, then gastrointestinal secretions, tracheobronchial secretions, all these exocrine glands will be stimulated and secretes respective juice. So these are the complete pharmacological actions of indirectly acting cholinomimetic drugs, and we have to segregate what are the therapeutic uses, therapeutic utility, and adverse effect components from these pharmacological actions. So we can say, and particularly in skeletal muscle, it will increase the muscle tone. So when we inject acetylcholine as such or indirectly acting cholinomimetic drugs, it will increase the repetitive firing at the muscle end plate and it will cause twitching and fasciculation. And even in higher doses, it can cause persistent depolarization and ultimately results in weakness and paralysis. When we categorize these pharmacological actions or the higher magnitude of pharmacological actions, it may cause like unnecessary events, side effects. We can say sweating, salivation, nauseating and vomiting sensations, decreased heart rate, that is bradycardia, increased peristaltic movement can cause abdominal cramps. So all these are the side effect profiles of cholinomimetic drugs. And this is a list of therapeutic utility of this indirectly acting cholinomimetic drugs. Mainly it is used in the gastrointestinal atony to increase the tone of the gastrointestinal smooth muscles. We can use all these cholinomimetic drugs, particularly in paralytic ileus, gastric stasis. Next we will discuss about the Alzheimer's disease. A hypothesis says there is a decrease in the acetylcholine concentration in the different parts of the brain, right? So if you use cholinomimetic drugs or indirectly acting cholinomimetic drugs, it will improve the acetylcholine concentration in certain areas of the brain and improve the, or it will cause a palliative effect in Alzheimer's disease. Another important therapeutic utility is in urinary atony, or post-operative urinary retention. So as we discussed in pharmacological action, it will contracts detrusor muscle and relaxes the sphincter pupillae. Thus, it is helpful in voiding or micturition. So in post-operative urinary retention, we can use all this indirectly acting cholinomimetic drugs. In curare poisoning, as well as curare poisoning, especially curare drugs can block the acetylcholine action, thereby it causes muscle weakness. So this can be reversed by using acetylcholine like drugs or indirectly acting cholinergic drugs. In glaucoma, already we discussed physostigmine along with the pilocarpine. It will improve glaucoma condition. Then myasthenia gravis, that we will study in detail, and atropine poisoning as an antidote in belladonna poisoning or atropine poisoning. We can use physostigmine. So these are the list of therapeutic uses of our indirectly acting cholinergic drugs. So we can identify this great celebrity, right? So he also suffering from a myasthenia gravis. So we will see what is the underlying causes for myasthenia gravis. Then what are the treatment modalities for myasthenia gravis? So when we talk about myasthenia gravis, we can categorize it into autoimmune disorders. Autoimmune disorders means our own antibody targeting our own receptors. So antibodies are produced in thymus and it will target NM receptors present in the muscle and plate. So thus it decreases the population of NM receptors at muscle and plate. When we see this picture, we can say in normal enough acetylcholine will be released and acts on respective NM receptors present in the muscle and plate. But here in myasthenia gravis, this receptor population is reduced because of targeting antibody. So antibody will target these receptors and neutralize or degrade these receptors. Thus acetylcholine, whatever released, it cannot bind to NM receptors, thus causing muscle weakness. So these are the common symptoms: generalized weakness, fatigability, okay, poor exercise intolerance. So these are the common symptoms associated with myasthenia gravis. Then we will talk about the treatment options. What are the specific treatment option for myasthenia gravis? Either you have to use corticosteroids. This is a known immunosuppressant, so it will suppress the antibody production itself, or we have to go for immunosuppressants. Again, it is targeting the antibodies produced at the thymus, or we have to remove thymus. So we have to go for thymectomy. So these are the some solutions or specific treatment options for myasthenia gravis. But to improve symptoms like generalized weakness, fatigability, we can go for anticholinesterases, either pyridostigmine or neostigmine. So these are the drugs which improve all the symptoms by increasing acetylcholine concentration at the junction of muscle and plate. So thereby it will improve all these symptoms, thus causing palliative effect in the myasthenia gravis. Thank you, and all.